15 expensive prescription drugs will see lower prices under Medicare in 2027. The drugs, including medication for cancer, diabetes, arthritis, and weight loss, their prices were lowered under the Inflation Reduction Act. That allows Medicare to negotiate. Well, NBC News correspondent Marquise Francis joins me now. So, Marquise, which drugs are covered here? How much are we talking about in terms of savings?
Yeah, well, President Trump, he really wanted to kind of strong arm these companies into voluntarily making these deals with the administration. They would receive things like relief on tariffs. And like, as you mentioned, the Inflation Reduction Act was signed into law by President Biden in 2022. And these 15 drugs are a part of that. And overall, they're going to save taxpayers about $12 billion, according to Medicare. And I want to pull up a full screen to go a little bit more granular, because as you noted, those big names, Ozempic and Wegovy, and as well as Rybelsus, they're going to go from $959 to $279. Then you have things like Trilogy Ellipta going from $654 to $175. And the big one that really stuck out to me was Brio Ellipta. As you're seeing right at the bottom of the screen there, it's going from $397 to $67, and that's an asthma drug. That's less than a fifth of what it was.
Wow.
And so it's not just weight loss drugs. These are things that people really need to live. And so this is a very, very big deal.
Yeah, cancer drugs, asthma drugs. So here's the deal. What happens if drug makers opt out? Because that is certainly part of the plan for them, but it's not without repercussion.
Yeah, they certainly can, but they may also go out of business, right? If they opt out, they're going to be off Medicare, which is the largest drug marketplace in the entire country, right? And so, but once again, there is legislation attached to this, and this is not the first time that we're seeing drug prices kind of being reached with the administration, because last year, President Biden actually signed 10 other drugs into law, and these included drugs that helped with heart disease, lung heart disease, as well as diabetes. And so this is a really big deal, because these drugs that people really need, 22 million people on Medicare rely on these drugs, and so it's a really big deal.
Marquise, before you go, let's talk about health insurance, right? A lot of people are worried their premiums are going to double, triple, perhaps even quadruple when these Obamacare subsidies run out. What is the latest on that?
Yeah, the latest on it, President Trump said he still will not commit to extending them. As recent as yesterday, while he was on Air Force One, he was asked about it. But the issue is he has not offered up what he wants to do in return. And so a lot of people are worried. 22 million people, it's really a big deal. And so people are wondering what's to give, and we still don't know just yet.
All right, Marquise Francis, appreciate it. Thank you so much.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.